Hi everyone, and welcome back to webinar 7 of the Sonder Youth Services webinar program. Today we're having a discussion about the early psychosis program at Headspace Adelaide with a service overview and future directions. My name's Claire, I'm from the community engagement team here at Headspace Adelaide, and I'm joined today by the lovely Oliver Schubert, and I'll introduce you in a second. But first of all, I'd just like to acknowledge the Aboriginal and Torres Strait Islander people as the first peoples of Australia, and we recognise their cultural, spiritual, physical and emotional connection to their land, and we pay respect to the elders past, present and emerging. So if this is the first webinar that you've joined us on, welcome. If not, well, thank you for coming back. So the webinar series has been going on for a few months now, and it's been hosted by Sonder. So Sonder is one of the largest providers of youth mental health services in the Adelaide metropolitan region, and we'd like to acknowledge our funding bodies, particularly the Adelaide Primary Health Network, in enabling us to provide these services. So these webinars are a great opportunity to build knowledge sharing and interagency connectedness within the youth mental health sector in South Australia. And if you're interested, we still have many more coming up for the rest of the year. So there's a calendar of the upcoming webinars that you can check out if you'd like. So just a bit of housekeeping. This is Demia if you haven't been here before. So we just encourage everyone to use the chat feature on the side for any questions throughout. We'll have a chance at the end to answer any of those if you have it. But otherwise, enjoy. So today we're joined by Associate Professor Oliver Schubert, who is a psychiatrist and serves as the clinical director of the Headspace Adelaide Early Psychosis program and as the head of unit of the continuing care and youth streams at the Northern Community Mental Health Team, Northern Adelaide Local Health Network. He has a research interest in the longitudinal evolution of psychopathy in young people and the molecular underpinning of several mental illnesses. He's published over 40 peer-reviewed papers in these fields, and Oliver has been a member of the Northern Integrated Practice Unit for Youth Mental Health since 2017. Thank you so much for joining us, Oliver.
Okay, thanks, Claire, for the very kind introduction. Hello, everybody.
So I'll hand over to you to have a chat.
Yeah, so I'm talking to you in my capacity as clinical director of Headspace Adelaide Early Psychosis Services, which I've been doing since about April or so of this year. But I also work for SA Health, sort of in Narlen, as part of the community teams here. And we've done the acknowledgement of country already. So I want to give you firstly a bit of an overview of what Headspace Adelaide does, and then what the Headspace Early Psychosis Service does specifically, because that's sometimes a source of confusion. So Headspace Adelaide is located in the CBD in Wakefield Street. And there are really two service streams at that location. So there's the Headspace General Mental Health Program. So open door counseling services for young people, easy access, mild to moderate presentations, GP referrals mostly, and also self-presentations, dealing with depression, anxiety, situational support, some physical and sexual health support, and then sort of stressors, work, school, or study can be addressed there. So that's the general Headspace program that most people are quite familiar with, and I'm not going to talk about that one today. What I will talk about is the Headspace Early Psychosis program that's also operating out of the same location. So the Headspace Early Psychosis program is a specialized intervention service for young people who are experiencing a first episode psychosis, in short FEP, or are at ultra high risk of developing a psychotic illness in the future. And that's abbreviated UHR. So those two abbreviations you might keep in mind. They'll pop up throughout the presentation a bit. The Headspace Early Psychosis Service is an acute and specialist multidisciplinary community mental health team, very much set up like other community mental health teams around the state. And we've got about 30 or so clinical staff that are really truly multidisciplinary. So psychiatry, general practice, nursing, psychology, social work, occupational therapy, a dietitian, peer support workers and carer support workers, and some access to drug and alcohol specialists. So really truly fledged community mental health team. And that team services a rather large catchment area, really the whole of metropolitan Adelaide, and it's geographically aligned with the Adelaide PHN catchment area. So it incorporates basically the whole of Naarlen, Carlin, and Saarlen. So anybody residing in those areas is eligible to be referred. And what the clinicians or the team provide is everything an acute and specialized mental health services would be supposed to provide. So a rapid assessment of people within about 24 hours of referral, capability for assertive outreach and home support, 7-day support, so there's weekend cover. Generally, people are case managed within this service. There's specialist psychiatric management through psychiatrists and registrars, psychological therapy and family interventions available. There's a functional recovery program, clozapine management, depot antipsychotics management, and management of people under community treatment orders. So all of those are available through this team. So very briefly, what is psychosis? It's a severe condition, a disturbance of brain functioning that affects the mind. And generally, it's defined as a loss of contact with reality, or a problem with reality testing. And it incorporates symptoms that affect various functions of the mind. So someone's beliefs and thoughts, someone's perceptions, emotions, and behaviors can be sometimes very severely disturbed if they've got psychosis. Psychosis is, of course, an umbrella term. And the DSM makes reference to a variety of diagnoses. So DSM defined diagnoses that can present with psychosis as a clinical feature, and I've listed some of them there. You'd be familiar with those diagnoses: schizophrenia, of course, and then various other forms of that illness. And then on this side here, bipolar disorder and psychotic depression, schizoaffective disorder. And then, of course, psychosis that are caused by organic problems, acute infections, delirium, etc., and by substances. And one differentiation that I suppose is useful clinically is that of non-affective psychosis versus affective psychosis. So the affective psychosis with a predominant mood component, like bipolar disorder, where psychosis sort of secondarily evolves in the context of a severe mood episode, versus those psychotic disorders where there's no clear association with mood. Psychosis is a very common health problem. So 3% of the population will experience a psychotic disorder, a psychotic episode at some point during their life. These episodes usually occur quite early on in life for the first time. So the average age of onset of psychosis is in late teenage or early 20s. And most people who will have psychosis later on will have experienced their first episode under the age of 25. Psychosis is often occurring together with other mental health problems, physical and mental health problems. So, for example, many people who become psychotic have previously had difficulties with depression and anxiety, often from quite early childhood. So the model that our service is working with or is oriented by is the EPPIC model, so the Early Psychosis Prevention and Intervention Center model, which was really set up by Professor Patrick McGorry and co-workers in Melbourne probably now 30 years ago. And the aim of that model was really to turn the focus in healthcare from chronic disease management to early disease management and early intervention to prevent sort of deterioration and prevent the chronicity if at all possible. So it aims to facilitate early identification and early treatment of psychotic disorders, and therefore reduce the disruption to somebody's functioning and psychosocial development. And everybody on the seminar who's ever worked with somebody with psychosis, especially a young person with psychosis, will know that having psychosis is a very severe disruption of life and of everything that was important to life and determined people's functioning before. And the guiding principles of this EPPIC model is that expert care is easily accessible, so people don't have to run around and find it through a tedious process. There's a holistic biopsychosocial approach to clinical interventions, where these interventions are offered in balance rather than overemphasizing one of those. The service approach is comprehensive and integrated. The clinical practice, very important, is guided by an evidence base, so not by clinician beliefs, but by practices that are actually proven to be helpful. There's a youth-friendly culture throughout the service, and that's also important because mental health services in the classic sense, if you think of asylum kind of care and even the early iterations of community-based care, can be described as anything but youth-friendly, if you've ever been to those sort of environments. So the environment is quite important to these services as well. There's a spirit of hope and optimism that's pervasive throughout the service. All aspects of the service are family-friendly and culturally sensitive, and there's a very high level of partnership with other local service providers. If you look at the EPPIC model or the guidelines that have sort of informed the setup of headspace early psychosis services, you see 16 components. And everything we do at headspace early psychosis is oriented alongside those components. And the elements are early detection, of course, and then acute care, and then various aspects of continuous care. And I'll show you in a minute how that looks like in a bit more detail. The idea, of course, behind all that is that if you detect psychosis early and you intervene optimally at an early point of view, at an early time point, that you can prevent a sort of a deterioration over time. So this is sort of a sort of naturalistic cause of a psychotic illness in terms of somebody's mental and functional development over time. The hope is if you start early intervention when they develop psychosis, you can really bring them to a much better level later in life. That's an intuitive idea, and of course, early intervention is a big topic in medicine more generally. And it was intuitive enough for many governments internationally to invest in this idea. In fact, there are many countries now that have rolled specialist early psychosis services out on a national basis, governed by nationally defined models, which are very similar to this EPPIC model. Really, it's been one of the first and certainly one of the big drivers internationally of how these services should look like. So all of those service models would do similar things. So we've got that headspace early psychosis model, of course, in 14 national centres in Australia. It's not national coverage. We would like to see national coverage, but it's coverage of most of the bigger centres in Australia would have these services set up at the moment. In Denmark, they have nearly national coverage of a model like Opus. In the US, they've actually made great gains over the last few years in rolling this CSC model out, and then some of the Asian countries have quite advanced early psychosis models as well. And the fact that so many services exist now and are very good at collecting data and looking at outcomes and measuring outcomes is now allowing really for investigations as to whether these models work. And perhaps the most comprehensive review was done in 2018 by this group here, published in JAMA, where a meta-analysis and a meta-regression was conducted on early psychosis services outcomes versus care as usual. So they had 10 randomized clinical trials that they could use for the meta-analysis, covering over 2,000 patients. And what it showed was very impressive. So what they concluded is that in all meta-analyzable outcome measures that they had, early psychosis services had favorable outcomes compared to treatment as usual by the end of the treatment. So this is just an example of the outcomes they looked at. This is treatment discontinuation, psychiatric hospitalization and relapse, rates of remission and recovery, symptom severity, again, psychiatric hospitalizations and how long they took, if they did occur, and then global functioning and quality of life. And you can see that all of those outcome measures were better if people attended early psychosis services versus other kind of more generic mental health services that were available in the relevant settings. So you really want to have your relative, your child, and your patient to have that type of service and care if they've developed psychosis, because the evidence is really quite unequivocal that going through a service with that sort of setup will produce better results. All right, so the next part is then a bit about referral and clinical processes. So what can patients expect when they come to Headspace Early Psychosis in Adelaide, and what can you expect as a referrer in terms of the process? So referral is via a website or a phone number. And there's a sort of a referral form that you can fill out, and you get a very swift response through that. We would really want referrers to contact us at the earliest opportunity, especially if these are hospitals or EDs or mental health triage or community mental health teams that have people who come in with an early psychosis or first episode psychosis. We really encourage an early referral to our service, because we will try and support hospital avoidance, for example. We'll try and support home-based treatments where that's clinically safe and feasible, and within our limitations. And we certainly offer joint assessments. So clinicians will come out to inpatient units, for example, and assess patients early on in their admission to make the link to the service. The eligibility criteria generally for the service is that we see people between the age of 12 and 25, so 25 included, who have a first episode of psychosis or are deemed at risk, at high risk of developing psychosis in the future. The exclusion criteria are people who had more than 12 months of treatment already for their psychosis by another mental health service, or by other clinicians. So typically people who've been on medications for 12 months or more, so we would not consider them early in their sort of treatment course anymore. What happens when people get referred? The first contact is with the mobile assessment and treatment team, so the MAT team. And MAT clinicians will contact the referrer and contact the client and undertake an assessment to establish whether that person is eligible for the program. And then we'll make a determination as to which specific stream they should be linked to. So the two streams are really clinical. So either people are deemed to being at ultra high risk, or UHR, which generally leads to a 6 months treatment tenure within the service. And the other stream is the first episode psychosis stream. So if people fall into that stream, they'll be offered 2 years of treatment within the service. And then there's the functional recovery program that people from both of those clinical streams would be able to access during their service stay. If somebody isn't eligible for the referral, we will try and support the referral to other services or advise of other services where that person might be more optimally supported. So we'll try and help with that process. I've talked about these 16 EPPIC service components previously that the service is guided by. They're listed here again. And these are really basically the clinicians that are delivering those services. So the mobile assessment and treatment team usually undertake the assessments in the first instance, establishing eligibility, and then also engage in the early course of treatment. So for stabilization, and they are very dynamic and mobile and can react to sort of evolving and sort of acute situations very well. And once people are sort of stabilized, or it's very clear what's going on with them diagnostically, they're transferred to the continuing care team, where then ongoing case management is provided, and further stabilization can hopefully be achieved. There's medical treatment, so psychiatry is involved at all stages of treatment throughout the service, from assessment to discharge, and that's provided by psychiatrists or by supervised psychiatric trainees. There's a strong focus on youth participation and peer support. So there are nominated peer support workers as part of the health team. And there are various ways of youth participation throughout the organization that have a very large role in designing the program and maintaining the program. And similarly, family programs and family peer support is a very important aspect of our care. There's a functional recovery program. So as I said, that's a service stream that is accessible to all clients, and that offers both group programs and individual interventions, such as creative therapy, support with everyday life skills, support getting back to work or study, or other social group activities. And this is a bit of an old schedule that has changed a bit. It just shows you kind of the breadth, I suppose, of the functional recovery program. So the weeks filled with groups and individual sessions there, and most people sooner or later will engage in that program and have great benefit from it. So the developments of the Adelaide Early Psychosis program, as any other clinical services, it's a dynamic organization. It's a dynamic service that needs to evolve over time. And there are really two areas that I wanted to highlight. The first one is to establish the early psychosis program offered by us at Headspace as an integral part of the mental health system in SA. And that is not something that is quickly achieved. That is something that really requires quite a lot of work. And Claire is one of the engagement and education officers within the service that spends her time out on the road with various stakeholders and in organizations to inform people about the service, the eligibility, and really encourage referrals. We try and form close partnership to other healthcare organizations. Of course, the SA Health funded specialist services, both through CAMS and through adult services. And we try and really promote this model and the service through early exposure of clinicians to it. So we've got postgraduate training posts in psychiatry and in social work, occupational therapy, and quite recently in exercise physiology. So these are sort of senior students who come through the service for placements. Oh, sorry, those are people in specialist training. Sorry, who are placed at the service as part of their specialist training. But we've also got undergraduate university placements throughout those disciplines where students attend our service. And we're certainly working across, or we encourage people to work across various mental health services. So to have a role, for example, at Headspace, and another role maybe through the state mental health services or another organization. So people like myself trying to straddle that, which we believe is important in integrating the system better as it has been in the past. And we're certainly supporting secondments where that's feasible. The other area of development is that we have a strong academic focus. So we've got many people with strong academic backgrounds as part of the clinical workforce. So people have done PhDs in various projects. And we've links to all of these local universities, so Uni Adelaide, Flinders, and University of SA. There are clinical trials going on an ongoing basis within the center, and it's well shown that services that have an academic focus and where active clinical research is undertaken have better outcomes. So that's something we emphasize quite a lot. We're part of the Australian Early Psychosis Collaborative Consortium, which has been funded to set up a national early psychosis registry. And that's underway, and that means that we are collecting data that goes into a national pool to really find out what are the main drivers of good or bad outcomes within these services. We've also very close links, of course, to Origin. So Origin is linked to the University of Melbourne, so the youth mental health organization, peak body nationally, directed by Pat McGorry. Huge research facilities there and involved in a vast range of clinical trials. Two trials that have been funded are underway in Adelaide currently is the Canary trial, so that's cannabidiol in ultra high risk, to see whether that would have some protective properties. And the other study is a $100 million project funded through the US, through the NIMH, also looking at the UHR group and really trying to find out at the biological and sort of more global level who is at highest risk of transitioning from UHR, so from high risk to early psychosis, and why. And our clinicians have all access to very good Origin education resources on a vast variety of clinical topics. So within this organization, we constantly encourage and facilitate sort of clinician learning and ongoing education. And with that, I'll probably close the presentation. I'm a bit over time already. Thank you.
Thanks, Oliver. And thanks for mentioning about the service. If anyone wants us to come out and do an education session or an overview further to their team or staff or things like that, we 100% have capacity. Feel free to get in contact with us. I'm more than happy to reach out. Considering time, is there any questions from anyone that we can quickly answer? I haven't seen anything pop up in the chat, so it doesn't seem like it. Oh, cool. I thought I'd also just mention, if you want any further education around psychosis, Origin has some great free modules online that you can access just as a health professional if you want to expand your understanding of psychosis a bit further beyond just our service. But otherwise, the referral forms on the website, like Oliver mentioned. And thank you so much for joining us, Oliver, and providing that great overview of the service.
Thanks for having me. Thanks, Claire, for organizing.
Awesome. All right. Thank you, everyone. And hopefully we'll see you at the next session. Thanks.